and many are still dealing with symptoms long after beating it. Channel 5's Monica de Anda shows us what some of those lingering effects can be.
It's called post-acute COVID-19 syndrome, symptoms lingering long after testing negative for COVID-19, effects of the virus thousands are dealing with.
We see a lot of people with chronic headaches or what they call brain fog. They can't remember things as easily. Other symptoms for sure are anxiety, depression, post-traumatic stress. We see a lot of that.
This is Dr. Marisa Gomez Martinez. She says patients are reporting a variety of post-COVID-19 symptoms, including chronic fatigue and loss of taste and smell. But it's shortness of breath, chest pain, and a persistent cough that Gomez Martinez says is something to closely monitor.
Although the majority may just be post-syndrome symptomatology, some of them can be very serious, such as blood clots. We've actually diagnosed a lot of patients with blood clots in their lungs.
Right now, between 40 and 50% of Gomez Martinez's patients are experiencing post-acute COVID-19 syndrome. She says other clinicians with older patients are seeing up to 70% of their patients dealing with ongoing symptoms. And one group of people that's more likely to be affected?
Those patients with chronic comorbid conditions such as diabetes, hypertension, older patients, they sometimes have longer lingering symptoms or more severe symptoms.
And while research continues, Gomez Martinez says it's taking people between 1 to 3 months after testing negative to fully recover from COVID-19 symptoms.
It's a multidisciplinary approach to treating a patient with post-COVID syndrome, and it's individualized per patient. We don't have all the answers at this time, but you're not alone in the symptoms that you're exhibiting.
So as the road to recovery continues, she encourages everyone to turn to their primary health provider for help. Monica de Anda, Channel 5 News at 6.